Okay, so next meeting of the committee, again, we're looking at the vaping and the opioid addiction. One thing I will let you guys know as well is our turnout here has been very low. It's usually been us, again, Sandra, myself, Linda, and then Diana Corbin usually will get in there as well. Renee had to excuse herself from the committee due to other family commitments. She just can't do it at this time, and so that's kind of where we stand. The other people that Patty had roped into it have been off. I haven't heard anything from them. I haven't got any response via email from them. Just crickets. So it is us as a group. When we talked the last go round we were talking about coming in with a couple different proposals. And then I had a conversation with Patty the next day, and she said, you know what? She goes, my interpretation of everything is we need one to cover really this. They didn't want to alter the smoking cessation codes or smoking counseling codes because they are so integrated, been around so long, that's why they didn't want change on those at the last year's meeting, which we already knew. And then I submitted what you see before you to Patty just for our big meeting that we had. So as it reads, the counseling for the control and prevention of adverse oral and systemic health effects associated with high-risk substance use. Counseling services may include a description of health effects, effects in oral tissue, and behavioral effects associated with high-risk substance use. Substances used in a high-risk manner may include, but not limited to, alcohol, opioids, e-cigarettes, cannabis, methamphetamine, and certain other pharmaceuticals. It was one.
I kind of have a problem with e-cigarettes being in there if tobacco isn't in there. I mean, because they're not, you're not talking about vaping or using, a vape where something is different than e-cigarettes. E-cigarettes are, a nicotine replacement. So I think that's kind of, and I think that will,
what would you suggest saying vaping devices or nicotine vaping devices? Do you like to identify?
It's not nicotine though. Nicotine isn't, I mean, if we're putting nicotine as a high risk substance, and we have to add tobacco there too.
But
tobacco is already existent and is something that we already have with the smoking cessation tobacco cessation.
There's already a code for tobacco cessation counseling. We wanted to try to incorporate vaping, as far as the terminology, if you're suggesting that it would be better to say vaping than e-cigarettes, I didn't know that there's a difference between those two. So, and because it's sort of new territory, it's a relatively new device. And also, we're just learning about the risks. And I wouldn't say that it's the substance that's high risk. It's the use of this.
Exactly.
Every individual.
So I would say that, or I would say vaporizers. I would not say e-cigarettes, because vaporizers, you can put opioids, you can put, cannabinoids, you can put
you can put a lot of things.
Methamphetamines, anything in there. An e-cigarette, to me, goes with the smoking sensation.
Gotcha. Is that the correct term? Is it called a vaporizer?
Yes.
That device, like Juul, is Juul considered a vaporizer?
It's considered an electronic cigarette, or ENDS, electronic nicotine delivery system.
Right.
And so, which is where all of these are kind of compounded under. And what's that? Oh, so okay, that's where they're all kind of compounded under, is electronic nicotine delivery systems. And that's something that I think we also have to word it with the group is, or to who our audience is going to be as well. I think e-cigarettes is a very common term that's very well known and kind of encompass it, or we can put in there vaping devices. Either way.
But an e-cigarette is not the same thing that you would use, like a PAX that you would use for cannabis.
Mm-hmm.
An e-cigarette is generally it's not those big vaping things that you see where people blow out crazy amount of smoke.
You know what? You are correct on that.
An e-cigarette is truly, and the Juul too. The Juul, as bad as it is, and I'm not saying it's good, the Juul is also an e-cigarette. I don't know what is wrong with my but yeah, I would say vaping device. That's great.
Wait, go back to that now.
I'm hitting all kinds of buttons.
All right, I want to read this sentence to make sure that that it makes sense. Counseling, we're talking about a code, and this is going to be the descriptor, not the nomenclature, but the descriptor. We'll get to the nomenclature later. Counseling for the control. I like saying counseling at the beginning because that somewhat mirrors the tobacco counseling code, right, although it's called tobacco counseling. Anyway, now, counseling for the control and prevention of adverse oral and systemic health effects. And I don't even know why we have to say oral and systemic. Why not just say adverse health effects associated with high-risk substance use? Do we need to? I mean, I think it's health effects, and we acknowledge some of them occur in the mouth, others occur systemically in other places, like, for example, the lungs. But that's so. This is just okay. I'm going to keep reading.
I like that.
Counseling services may include a description of health effects on oral tissue, and behavioral effects associated. See, that's getting a little convoluted there. That second sentence, starting with counseling service.
Yeah, I would say at that point, I agree with you. I would take out oral and systemic, and then description of effects on oral tissue.
So just
and
for
behavioral.
Jamie, just for the purposes of our discussion, could you separate these sentences into individual sentences? You know, with a like enter.
Yes.
Just so I can look at them separately. There you go.
Counseling for the control and prevention of adverse health effects associated with high-risk substance use. Okay. Counseling services may include a description of
health effects.
Or would it say
I would just say oral and tissue.
Oral and health, because it has to be more than just oral health effects. Should we expand this to say would this be the place for oral and systemic health effects?
Why do we have to? I mean, it's health effects, and we're trying to like make that connection. This again, my recommendation would be that we're acknowledging that there are oral effects, but also systemic effects that we're talking about, and they're and what's this behavioral effects associated with?
Well, the addiction properties,
cannabis,
the cannabis, that part of it.
Well, okay, that makes a pretty big assumption that addiction is a behavior as opposed to.
Well, it might not even be addiction. It just might be that it makes you lightheaded, or it makes you confused, or I don't think it's, I didn't get it that it was talking about addiction. I got it, you know, how you might feel when you're drunk or how you might feel when you're using opioids.
Mhm.
Yeah.
I had a thing, the assistant in my old office had, thank you, had a really bad back and, or hurt her back, and one of the other girls in the office gave her a Visceral with her doctor's recommendation because she couldn't get to the doctor, and she called her and said, you know, she was like so loopy, it was crazy.
Mhm.
So that was my kind of, you know, description. I mean, people may not realize that, you know, people may be using opioids and not realizing that they have, that it can
Alter the behavior.
it can result in high risk. Yeah.
Well, and
You know, I mean,
another,
someone who's been prescribed it properly, you know, should still be educated, even if they're not at an addicted point in their use.
Right. Okay, so let's go back to the middle sentence. Is that I like the first sentence. The second sentence doesn't make a whole lot of sense, but counseling services may include
or
how about
instead of
this?
description, education.
Education or description. Sure. Here's where I'm going with this. Now you're going to make a list of some type, which is fine, and that word may allows you to say a few things that may be included. Counseling services may include descriptions of health effects, effects on oral tissues, behavioral and behavioral effects. In fact, we probably have too many effects. May include descriptions of well, yeah, okay. So
Changes, how about
oral and systemic health effects and behavioral? Well, it's basically three things: oral effects, systemic effects, and behavioral.
right? So counseling services may include descriptions of systemic health effects.
Systemic, oral, and behavioral effects associated with high-risk use. We've got too many.
Should we say descriptions of oral, comma, systemic, comma, and behavioral effects associated?
Yes, that's what yeah. Well, systemic and behavioral health effects. I don't know. Yeah, do you know what I'm saying?
Oral, systemic, and behavioral. Shush. Counseling services include descriptions of oral, systemic, and behavioral effects associated with high risk. Yeah, I like that.
Is that better?
Substance use. Yes. Okay. Let's leave that alone for just a second. Now, you're in the third sentence. We're describing a list of substances that may be used in a high-risk manner, and that's where vaping device is not a substance. Get what I'm saying?
Okay.
Yep.
It's not a substance. So it could be nicotine. Maybe substances used in a high-risk manner may include, but are not limited to, alcohol, opioids, nicotine, cannabis, methamphetamine.
And then I think we need to take out the word certain and just say and other pharmaceuticals.
Right. Well, yeah. Yes, I agree with that. We need some spaces in a few places there too, but that's not a big deal. Yep. Okay, so what this does, now we haven't used the word vaping devices, even though that was the primary reason that this code came to the attention of the code committee. And I'm not sure, but we are talking about other, I mean, as dental professionals, we have patients who are into high risk use that we can see the effects of it in the mouth. We know about the effects on the body, and maybe we're the ones who can help them understand, you know, more about what they're doing in case they don't know. So how do you think it's important to get vaping or vaporizers or whatever it is, the e-cigarettes? I think the current term right now is e-cigarettes, even though, you know, that, well,
I
yeah.
personally, I think we need to have it included in there somehow. However,
So vaping, could we say vapor? I mean, vaping is a verb.
It's new territory. That's what I'm saying. I'm looking at a call to action by the U.S. Surgeon General that was written. I think I shared it with you, Jamie. But it says we must take action to protect the health of our nation's young people, and he uses the term e-cigarette.
yes. And there's everything from the Surgeon General to the FDA to the CDC has all information on this. And it's either e-cigarettes or vaping devices. And all
Vaping device.
You look at them.
Yeah.
Yeah, I get it. But it's like telling our patients that they have to floss when in reality they need to clean in between their teeth. And there are other things that they can do. You know, most people want you to floss, but if you're not going to floss. So, I mean, to me, you know, that's why I don't want just e-cigarettes there. Because, you know, there is a place in the world for e-cigarettes, just not as widespread and not when it's abused. So why don't we say,
and I'm not going to disagree with that. I think there is a place for it. But I think where this code comes about and where society is coming about, and especially in the healthcare, is not necessarily those who use it to properly, but those who the epidemic, especially among young people. And I think this is where they're coming for this.
I agree, but I don't think the you know, like, you're right. I mean, you know, there are 12-year-olds that are using e-cigarettes because they can get it where they might not be able to get, you know, actual cigarettes. But
and I think that, like any of the other codes too, it's to be used with discretion. Not everybody who uses it would fit under this for the counseling that we see as patients. It's those that are at the high risk use, which is what we're looking at. Those who are using it. If you saw in the news a few days ago, was it Wisconsin that has 8 kids that are all hospitalized right now from effects of the vaping, and they were
on their
what were they vaping?
That's still part of the question.
I think the was nicotine, but maybe there's some investigating that will be done. Yeah, there's
been nicotine poisoning, and there's been reports of that as well for kids that are doing this and really overusing it in that high risk, that the way that it shouldn't be used. And that's where this is going to come in, to being able to educate them.
Can we go back to, I think, the place to include whatever term we agree on, and let's just say right now we have some options, but is the first sentence, and let me just roll this by you, and then we'll, you know, maybe we're not going to come to an agreement about what the term is that we're going to use, but because it was the vaping devices that came to the attention of the CMC, that one, Dr. Perlman said, I intend for this to pass this year. Anyway, she's going to work on it, and so are we. But anyway, so counseling for the control and prevention of adverse health effects associated with high-risk substance use, including vaping devices or e-cigarettes. And we could put e-cigarette in quote.
Could we do high risk substance and device use? No.
My thought on that is, this is the first sentence that's going to come out on it is high risk substance use, because I think if we put that specifically there, it's going to knock out the stuff in the last sentence where we're including the alcohol, the opioids.
Right.
I think it needs to be within that last sentence as well. So
Okay,
we're going to cover our bases on all of them. That's my thought.
Substance used in a high-risk manner may include, and could you add the word are, but are not limited to at the bottom? Yep, right there. Okay. Are not limited to alcohol, opioids, nicotine, cannabis. I mean, I like having that list, and other pharmaceuticals.
Vaping substances.
Well, and
vaping solutions.
Well, but
Vaping products.
Yeah, let me think about that. Devices, okay, we're talking about two things. We're talking about the substances, and to be honest, what's kind of emerging, at least my impression is what's emerging in terms of evidence is that some of the flavoring ingredients are the culprits in some diseases that are occurring in the lungs. It's not the nicotine. It's the flavoring.
Glycol and the other stuff in there that has been, for human consumption, the diacetyl is used in popcorn flavoring. And for human consumption, it's been proved okay. But when it's heated and aspirated into your lungs, that's a problem.
Yeah, and that's actually, not used in vaping anymore. I mean, not that it's not regulated, you don't know, but generally, if you talk to anyone, they don't use that anymore. But
how about this? Routes? How about this? Routes and substances. So the routes are ingesting, injecting, and inhaling.
Oh, yeah, absolutely. Other substances, yeah. You may be looking at something like heroin if they're shooting up heroin. We've got methamphetamine there.
Snorting it,
Right. So maybe that's where we routes of use or routes of administrative use. Well,
how are we going to do this?
High risk substance. High risks. I'm looking at the middle sentence now. Well, let's just put something in there. Do you like administration or
How about in the second sentence you do associated with high risk substance use and the administration and
their administration routes?
And their administration of,
Let's try that.
Right here?
Yep.
Yeah.
And here. Routes. Let's look at that now. Include descriptive routes, different effects. Do you want to say here, including, well, are we going to make a list? Oral, systemic, and behavioral effects associated with high-risk substance use and administration routes. I kind of like that. This includes, how about another sentence? We're still talking, no, I wouldn't put vaping down there because, again, those are the substances, but right after routes, let's say this includes ingesting. It's another sentence, period.
Okay.
There. This includes ingesting, injecting,
Ingestion, injecting,
and vape.
inhalation.
Healing, yeah.
Well, if we're going to do ing, we have to use ing after all of them. So ingestion, injection, inhalation, or ingesting, injecting, and inhaling.
Inhaling or inhalation?
Inhaling.
Well, either we do ingesting, injecting, and inhaling, or how you have it now, ingestion,
I would-
injection,
Yeah, I wouldn't mix up the endings of those.
inhalation.
Right.
I happen to think the ings are better, ingesting, injection, injecting, and inhaling.
Mhm.
The change in, yeah, injecting and ingesting.
Mhm.
Motion detected at your front door.
Okay.
So then
Do you want to say?
how do we tie since they were really catching the attention on the vaping, how do we tie that into this?
Okay, so we can say, instead of saying high risk behavior may include substances not limited to alcohol, blah, 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 and devices such as vaping. And you could even say such as vaping and e-cigarettes. You could add e-cigarettes to that. Such as vaporizers and electronic cigarettes.
Which sentence are you talking about now?
So the third one, say high risk behaviors may include.
No, we're the third one. The reference is the third sentence is talking about the substances that are used.
We want it to include devices too, right?
We need to tie in the vaping somehow in there, and that's how we're trying to figure out how to do it.
Right.
Okay.
So let me see. So high risk behaviors may include substances such as alcohol, opioids.
How about, and just a thought, instead of saying substances used in a
Motion detected at your front
just put it
door.
high risk behaviors may include but not limited to alcohol, opioids, vaping devices, cannabis. And so instead of we're taking out that substances and just making it high risk behaviors may include, or high risk. What about that?
So high risk behaviors
High risk
that
behaviors may
have
include but not limited to.
You could be talking about seat belts, not wearing your seat belt, or not wearing a helmet, or those wind up being driving too fast, that kind of stuff. That's high risk.
So that's why I'm saying high risk behaviors may include.
We've got it associated with high risk substances.
Okay, so then why don't we have another sentence saying devices used in a high risk manner may include vaporizers and e-cigarettes.
Thoughts on that, Linda? Or high risk substances may include but not limited, because vaping is an action, but it's.
I have an idea. How about you could say the delivery of such substances by using vaporizers or electronic cigarettes. No, because then that takes away all the ingesting and the inhaling and the injecting.
Mm-hmm.
No.
This is a hard one.
Well,
Figure out how to tie that in.
right. I mean, especially since we know that at least one person, I'm sure there are others, on that committee really like the idea of this, but how do we want to stick with just the e-cigarette type devices and all of the the counseling? I think at least it seems like we wanted to include other things. And as soon as we did that, then it's becoming a gigantic code. But I think it's worthy. I think it's worthy of consideration. And so, we could try. We could try putting something in the very first sentence because it's a new thing. We want to kind of highlight it by putting it either at the very beginning, and maybe we'll have in our nomenclature, there will be there'll be something in there that identifies e-cigarettes. And again, over time, that may change. I may stop calling it electronic cigarettes at some point in the future. But right now, today, that's the term that's being used by public health people.
Mm-hmm.
We've got a problem. We have a problem.
Yeah. It's actually vaporizers and e-cigarettes by the Surgeon General.
Right.
Because when you talk about e-cigarettes, you're talking about a cigarette replacement. You're not talking about.
Well, that's the intent, but the impact has been a whole lot of things besides smoking cessation. The intent was for people to use it. At least that was their declared intent, and that's fine. That's a good thing. However, the impact is far more important. The actual impact of its use and kind of incorporation into our society and what we think about and what we're doing habitually or at all, even experimentally, is the impact is far different from smoking.
Right. But I think you're using the word car when we really when you really want to discuss vehicle. You're identifying one thing.
So how about back up to sentence number 1, the word use, and you've got period. How about including adding the ending, a new ending to that sentence, including e-cigarettes. And then our second sentence identifies inhaling as one of them. But, I mean, there's smoke inhaling and then there's vapor inhaling, which is different from smoke. So anyway, what do you think about that? Back to for including e-cigarettes, just to get that word in there.
I would like vaporizers and e-cigarettes.
Okay. The concern that I have with that, Sandra, is how most people deem it, and also how the when we pull our research, most of it doesn't list it as vaporizers. They list it as ends, and they list it as e-cigarettes. And we don't want to make it too wordy. I think I'm with Linda on the e-cigarettes part of it on this part.
Okay, but e-cigarettes is electronic nicotine device. You're not educating people then. It wouldn't be educating people on when they're using, the packs, or heroin in an inhaler, which they're, which in a vaporizer, which people are using. You can't put a substance into an ENS.
I think think this through.
And you're right, the general public might think that you can, but we're doing this for healthcare people that should be educated. And I wish Diana was here because she could explain it better because of her husband.
And my fear is to make it too wordy for, because.
How about this?
Go ahead.
Vaporizing devices such as e-cigarettes, or e-cigarettes such as vaporizer. No, that's not the same. I don't know if we are going to wind up with lots of these words, but here's what I think can happen if we write something, these 3 sentences that captures the essence of what we were trying to do, and we share this with Dr. Perlman and tell her, like, we've been kind of sort of orbiting this idea, and we've landed a couple of different ideas for how to word it, and here's what we have. We're open to suggestions, and I think we could also invite her to participate in a discussion. I don't know if she wants to do that, but she seemed open to working with us, or at least reviewing what we have, and she said, I'll share with you when I'm ready, but like, okay. I'm not sure what to think about that.
Have you heard from her recently, Linda? Because I've tried to reach out to her twice with no response whatsoever.
Okay, how did you?
I've done it through LinkedIn. I've tried to find her via, I did it through Facebook, found her on there. I haven't had any response either way.
Okay.
As we go down to, I'm going to
detected at your front door.
coalition-wise, I reached out to other members on the AAPHD as well. I did that this week, as well as the AAPD, the pediatrics, because this is something they're considering epidemic proportions in children and so that's a coalition that I thought may be worthwhile to looking into, and so they may have an interest or a say in it because it is affecting the kids.
Right. What's the AAPD? Remind me.
American Academy of Pediatric Dentists.
Okay, gotcha. Right. Well, if you have a contact there, rather than approaching the entire organization, somebody who belongs to it, and ask them. I mean, especially if they've ever had made a proposal to the code maintenance committee, that would be good, so they know what this process is like. We want feedback on what we have here. What we're struggling with is trying to get a term in this descriptor that tells people exactly what we're talking about. And what we're talking about is e-cigarettes or vaporizers, perhaps both if there's a difference. I did not know that. I didn't know that they were considered different. Vaporizing devices, and as long as we're at it, I guess that's our attitude. As long as we're at it, there are other high-risk substances that can be used in a way that's harmful to our patients, and we'd like to have a code for educating them about that, because it may take some time. Anyway, how do you? We could also put in parentheses and say, here's what we're struggling with. We could say at the end of sentence number 1, high-risk substance use, including substances, including those that are delivered by vaporizing e-cigarettes, vaporizing or e-cigarettes, and something like that. And let the wordsmithers kind of hammer, like kick it around. Think about it. We can get help from other people too.
Yeah, but why would you put that up there and not in substances that might be used by needles?
Well, because The reason I want to get it in that first sentence or call attention to the vaporizing devices and e-cigarettes in the first sentence is because that's the number one reason that we're writing this code. They're number 2, 3, and 4, obviously, but it's because, at least in public health circles, it's considered a crisis situation.
Mm-hmm.
People are worried about it.
Absolutely. But are we going to alienate everything else if we put that in the first sentence versus substance the last sentence? Is that?
I don't know.
I don't know either.
I don't know. We could have a where do we had routes of administration in the second sentence. So yes. We have the substances and then we have the route.
You could almost add a route as vaping
instead of inhaling.
Inhaling.
Because you would inhale. Well, yeah.
I mean, you could include ingesting, injecting, and vaping, because you're not talking about cigarettes, and vaping is a verb now.
Okay, that's why I said you're in cigarettes. When it comes to cigarettes and tobacco, you're inhaling the smoke. In the case of e-cigarettes, you're inhaling a vapor.
A vapor.
So I still like inhaling. But the vaping is what you do to the substance. You vaporize it and then you inhale it.
Should we say inhaling?
The word vaping is the action or practice of inhaling and exhaling the vapor produced by an electronic cigarette or vaporizing device.
Right.
To inhale vapor through the mouth from a usually battery-operated electronic device.
Right. Still inhaling. The route is still inhaling. You're just inhaling a vapor instead of smoke.
Right, but isn't that what we're?
What about we have inhaling and vaping? Because the inhaling would work for the cannabis, and then vaping for specifically the vaping devices. Ingesting, injecting, inhaling, and vaping.
I think we need to have inhaling. I'm not. We could try that, but I think it's kind of.
I like that.
We can try it.
Something like that.
Let's try it.
And that would bring the vaping into it.
Mm-hmm. Again, it's one of those things you just hear. Let's present this.
Okay.
Let's say this is what we have, and say we recognize that you're inhaling. You're inhaling when you're vaping. When you're vaping, you're inhaling. But we wanted to get the word vaping in there, or we wanted to get either vaping or e-cigarettes in this descriptor so that it can be clear what we're talking about.
Mm-hmm.
If we don't have vaping and we don't have e-cigarettes anywhere in this descriptor, people are going to go, what am I doing exactly? Well, we're counseling about non-therapeutic use of drugs and other things in a high-risk manner, counseling.
So
on that.
we have
Anyway,
vaping there under substances. Would it be worthwhile to put e-cigarettes down under the substances? I mean, they're
no,
a device. Okay.
You're talking about the chemical.
Mm-hmm.
The little sentences about the routes and the substances that we're talking about being used in a high-risk manner are those listed there.
Okay.
And others that may come up that we're not talking about, but the 1, 2, 3, 4, 5, alcohol, opioids, nicotine, cannabis, methamphetamine. You've got 5 and others that may happen in the future that we learn about. We don't know about them now, but people are like glue, like sniffing. Again, glue sniffing, are there oral effects, or is, you know, they inhale various, I don't even know, but yeah, let's just say it's glue.
Okay.
That can be included here. You know, what if our patients tell us they do stuff like that and their throat hurts? Like, oh, okay, well, there you go. Other substances. That's where I don't like the word pharmaceuticals, because a lot of stuff that people get into are not pharmaceuticals at all.
So what would be a better?
Chemicals. I mean, substances is the broadest type of term, but it could even be food products that they set on fire and breathe them. People are crazy.
Yeah, because you're right.
Let's see, synonyms for substances: materials, ingredients, let's see, yeah. Materials, matters, ingredients, constituents, elements, stuff, bodies.
Well, you could say other pharmaceuticals or chemicals. How about that? Other pharmaceuticals or chemicals.
Or what about other pharmaceuticals or materials? Because if you're talking about like glue, wouldn't that be, you know, it's not a material as in a piece of cloth, but it's
Other pharmaceuticals or compounds. Just to throw.
I would not be able to tell you a single compound. You know what I mean? I'd have to go back to chemistry and say, what constitutes a compound? Is it like 2 molecules, or is it 2 distinct substances that are combined? You put them in a shaker, or, you know what I mean? I understand the basic idea behind compound, but I have no idea if people use.
Virus matter may include, but are not limited to, alcohol, opioids, nicotine, cannabis, methamphetamine, and other. I mean, can we do substances again, or that would be wrong?
Pharmaceuticals or chemicals. Are you willing to at least try that? Just float that, run that up the flagpole and see what people do to it. Because maybe they'll hate it, and they might, but our logic is we're trying to have this be a meaningful code that is useful, especially as we're looking at what people put into these vaporizing devices and inhale into their lungs, and that makes them sick.
And that's why I like the idea ingredients, but
I think I like chemicals over ingredients on that one. I think that's to my mind. I think ingredients. I think cooking. I think it just reads.
But that, when you're talking about the flavoring, that's exactly what it is.
Well, is it a natural? Is it a natural flavoring, or is it a chemical that's made to taste like blueberry?
Some are, some aren't. You know, but I mean that's exactly what it is. You know, but that's fine.
And I know that when people heard us talk about high risk versus habitual, that their reaction was, I don't really know if I like high risk, but the reason I suggested that is it comes from a combination of the motivational interviewing as a technique of counseling people who have a problem of some kind, and the healthcare provider is trying to partner with them to solve that problem or to make some changes, have them agree and understand, And as soon as you talk about habitual or abuse or addiction, compulsions, those kinds of things, it puts such a negative, what do I want to say, a stigma.
Absolutely. I'll never forget, I had a patient years ago who came to me and said to me, well, I can't be an alcoholic if all I do is drink wine, right? You know, and you know, and if I had said to her, you know, if I started with, you know, a habit that, you know, I love high risk much more than habitual.
I agree. I like the high risk.
Right, because you're not calling someone out, you know, even if one person has one, you know, joint, that's a high risk. It doesn't mean that they have to have one every week or, you know, daily smoking or something. You're still counseling them.
Mm-hmm.
All use of these products, whatever we're talking about on that list of substances, all use of those substances is not high risk. Some is. I would argue that some are way more risky than others, but that's one of the things that you learn about when you're talking to a knowledgeable person, when you're listening to them describe, okay, where does this cross the line into high risk, and it's what would that look like? And that's where our counseling, anybody's counseling, can help them figure out, okay, I don't want to cross that line. I want to stay healthy. I want to live, you know, I want to have my life. So, okay, I think we're in agreement about the use of the term high risk as opposed to some of those other terms, but we have to explain that it helps people come along in terms of their health.
Absolutely. And it's the education component too, to provide that to your patients. I was reading a study, say on Juul. All of Juul's contains nicotine. But when they interviewed high school students, 80% of those didn't know that all of them contain nicotine, all that specifically Juul brand.
Isn't that amazing? Yeah.
And so it brings in that, again, that education, that the high risk factors on it. So, now, are we kind of in agreement? Let's see where this rolls.
Yeah,
Let it get picked apart and go from there.
I think we have to, like I say, run it up the flagpole and get feedback on it, but then also be ready to say how we came to these 3 sentences and why. Because I think our discussions have been good, and yeah, I like there's certain things I'm not crazy about, and other people are going to be even less crazy about it. They hate lists, but how do we get it in there if without a list?
Exactly.
And especially that last sentence, where dental health care providers should be knowledgeable about, but if they're not knowledgeable about it, they at least should have some awareness. And here's a code that can be used if you're going to spend some time educating your patient on the subject of high risk.
My conversation with Patty as well, bringing it up, and she said, well, opioids. Well, some states have mandatory opioid training for any healthcare provider to take before they're able to do this or prescribe any of them. There's opioid, I mean, the addiction is extremely high for those to be misused. And so bringing that into it as we start to dig deeper, you know, that's why this is on the list, because there is such a problem, and being able to educate our patients with high use or high risk factors on it. And that's, I think it is, and where cannabis is being legalized in more and more states. Again, there's recreational use, and then there's a point that becomes, or medicinal uses, and then there's a point that becomes high risk use. It's identifying those high risk use.
The thing that concerns me most, quite a bit about having a lot of cannabis in the house, and particularly edibles, is kids.
Toxicity in kids, absolutely.
Kids get into it. It's not going to hurt the parents or the adults in the house, but a little kid sees all the gummy bears or brownies or whatever.
And there's lots of on kids are getting nicotine poisoning through the vape juice as well. Young toddlers who, because it smells good.
Yeah.
And there's been lots of reports on that too, either ingesting it. Some have gotten it through the skin, spilled it on themselves and it's absorbed through the skin.
Wow.
And then again, ingesting it and ended up, hospitalized with acute poisoning.
Wow.
So, that all falls into that factor as well. Okay, let's roll with that and see where it flies. I have the same report that you sent, Linda, on the Surgeon General's, and they also have information for healthcare professionals on what you should know, and then a couple links on that. And I think things like this are going to go far once we get in front to back up our proposal and have that testimony to back it up as well. We're bringing the Surgeon General's report saying, we should be knowledgeable on it. We should be able to include and screen patients.
Right.
So, and then I'd skipped ahead earlier on the coalitions. They're the ones that I reached out to some of their board members on those, just over the weekend, and I haven't heard anything back.
Do you want to send what we have with some short explanations of the 3 sentences that we came up with and why the words are the way they are, to, for example, Sharon, do you want Sharon Perlman and then whomever at AAPD?
And I didn't even see her listed on the AAPD website.
I didn't either.
And so I don't know if you've got an email for her.
I don't. That's what I was looking at. I did a little searching around trying to find an email address. And she did say, yes, I'd be happy to connect with you, but I'm not ready to share what I have, so I'll get back to you when I've got something. Those were her words. So I could ask her for her email address via LinkedIn and say to her, a small group of us, a small work group of us in the Codology Consortium have been working on fixing the code language for this, and I'd like to share it with you and get your feedback. Would it be okay? Could you send me your email address?
Okay. Yeah, if you could reach out to her, I've had no luck, would be amazing.
Okay, I will. Yeah. Okay, and then maybe I'll just try to introduce you, particularly you, to her as kind of the leader of this little group too. So.
Okay.
I would be happy to do that. And are you going to send us? Go back to where's my phone? Yeah, there. I'm going to take a picture of that. Hang on. Don't you love cell phones? Just so I have it right away. Got it. Okay, thank you.
Perfect.
Got a picture.
Sounds good. Well, I will go with that, and then let's see where this takes us. And are you going to be under one roof again, Sandra?
I am.
Oh, I'll be there. I'm already in Texas, so.
Oh, wow. Okay.
I came down yesterday. My sister lives here, so we've been running amok for yesterday and today.
Nice.
Yeah. So it's been fun. So I'm sure I will run into you there. Safe travels.
Thank you.
And then we'll see our next meeting too. I know I'll see Patty, so maybe if I'll bend her ear on this a little bit more as well, and we'll kind of keep you posted if I hear from others. And I apologize for last week. Youngest sister had her first baby, little girl.
Oh, right. How was that? Little girl. Good.
No, she's the control
Everybody's
freak.
healthy?
Everybody's healthy and happy. She's the kind that, was convinced that it'll be a nice, quiet, calm birth. Everything will go as it is. She's had her world rocked a little bit, which I'm kind of enjoying. She was rather confused that the baby doesn't reserve pooping between 8 and 5.
Oh, doggone it. Like,
No,
what's that about,
The middle
huh?
of the night, the 4 a.m., and she's exhausted because she only sleeps 3 hours at a time. And I'm like,
Yeah.
you're getting lucky for a newborn. You're getting 3 hour stretches. That's impressive.
Wow.
But no,
But it-
everybody's healthy and happy. So
Good.
yeah, cute
Good.
little thing.
Mm,
So
that's nice.
Nice.
Congratulations to everybody, and say hi to the other, like the peeps down in Dallas that
oh,
you're
I
gonna run.
will. I will. It'll be fun.
Yeah.
So yeah, I'm
Maybe
looking
we'll-
forward to it.
Or something, so. Okay. I
Wonderful.
haven't packed, so I'm gonna say goodbye.
Sounds wonderful. Thank you, Sandra, for all your help.
Okay.
You're welcome.
Night.
Different views.
So absolutely, absolutely. So we will go from there, and I'll stop and we'll chat again hopefully next week.
Sounds
Great.
good.
Okay. Thank you, Linda. Thank you, Sandra.
Sandra.
All right. Bye
Fun
bye.
in Dallas.
We will.